The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. With us today, we have Las Vegas's go-to guy when you want a world-class smile, Dr. Mike Golpa. Dr. Golpa, welcome to the program.
Thank you. Thank you for inviting me.
Now, before we get into today's topic, tell us a little bit about your practice, because I guess you do a lot of different things.
Well, we do a lot of full mouth reconstruction, cosmetic, and included in the full mouth reconstruction, there's a lot of times that we have to place implants.
Now, are the patients getting older and older that are getting cosmetic dentistry?
There are all types. You know, there are all types of patients that want to get veneers done. You know, even patients who are 50, 60 years old, they want to improve their smile, they want to improve their lifestyle.
All right.
They want to be able to socialize and, you know, start dating.
Now, you don't look like a dentist. Do people tell you that?
Well, what do I look like?
Well, I don't know, some other profession. I mean, I feel like you're too cool to be a dentist. But, I mean, you have definitely a sense of style. When did you know you wanted to be a dentist? Was it you were in college? I mean, you always knew you wanted to be a dentist?
Yeah, before I went to dental school. You know,
like in high school?
I always wanted to, you know, do something with my life that be able to help people, you know,
okay.
and, you know, getting a beautiful smile and being able to improve their lives and their self-esteem, and it's combination of artistry and science, and I love that, you know.
You're an attention to details kind of a guy.
Yeah,
I spoke to Tammy at your office.
Well, you know what?
Everything counts,
in dentistry,
you say.
Everything counts. Every smallest micro details makes the big difference, you know, in dentistry especially, you know.
Okay, now when I think of, you know, cosmetic dentistry or veneers, I think of actors or news people doing it. You say everyday people.
Everyday people. You know, I think if it improves your self-esteem, your smile, your you know, if the patient needs a full mouth reconstruction, if it gets rid of the headaches and the neck pain and the jaw pain.
Now, when you mention full mouth reconstruction, you know, and you say these are patients, I guess, that come in and their mouth is a mess.
Well, they come in, they have worn teeth, they have, they frequently get headaches and they don't know what is causing it. They get neck pain, they get jaw pain, they have periodontal disease, their bite is all shifted. So the main thing
you fix those things and then do the veneers?
Yeah, exactly. The main thing to consider is the bite, if the bite is in the right position. And once we calculate where the bite, ideal position should be for the bite, then we'll go ahead and, you know, prepare the teeth for either veneers or crowns, or if the patient has missing teeth, we'll just place implant.
So dental implants?
Dental implants.
I mean, sometimes somebody comes in for cosmetic dentistry, you have to do a combination of dental implants and veneers?
Combination.
Oh, is that right?
Because I'm totally against doing a bridge. So I'd rather just replace a bridge with an implant. That way, you know.
And the implants can look real.
The implant can look completely cosmetic.
Claim.
Yeah. Well, everything I do is cosmetic. So, you know, once we place the implant, we make sure that the emergence profile from the gum looks completely natural. And, you know, you have to make sure the structure around the implants are healthy. And in order to preserve the bone, the implants will actually help to preserve the bone around adjacent teeth. So
now you're going to show me photos, but I want to ask you this question. In a few moments, we'll go to those photos because it's pretty dramatic stuff. Anybody watching this, they've got to stay to watch the photos. But so are there people that their mouths are just too far gone that they're not candidates for? I mean, for you know, cosmetic dentistry?
There are people who are thinking that their mouth is too far gone, and they either have to extract the teeth and go to a denture or a full mouth implant.
Okay.
But a lot of times you will be able to save these teeth. You know,
but this is your specialty. I mean, this is what you do.
Well, if the teeth is salvageable, and that's you know, that's what I do. I do a full mouth reconstruction. I make sure what's the ideal treatment for the patients.
Okay.
Either we have to place an implant, or if we have to extract the teeth, or if we have to put the veneers on the tooth. So full mouth reconstruction, you know, has a lot of benefit for the patients. Not only, you know, it will alleviate the pain that they were suffering for a longest time, the headaches, jaw pain, jaw popping. But the bonus to all of it is they're going to get a beautiful smile once they're done.
You see a lot of people don't smile.
A lot of people.
Now, I don't hear the stories, but you're a dentist. I mean, do they come to you and say, I haven't smiled in years?
I see them all the time. They come to me, they don't know how to smile because they've been always trying to cover up their their teeth. You know, they don't smile. They're not being socialized. They're shy. They don't have the self-confidence.
But after they get their smile,
but
do
after
they
get the smile, oh my God, yeah,
like they transform.
They transform. You know, I mean, they get executive smiles, and they'll be able to get promoted at their job. They'll be able to socialize better. And
but you're a dentist, of course you think teeth are important.
Of course, having a beautiful smile has a big impact on the patient's life. You know, being able to smile, people who smile, they look happier, they look
That's
better.
true. Good point.
And study shows that the people who smile more, they're more successful in their business,
Is that right?
in their relationship. Yes, of course. I mean, it's like something that it changes their whole appearance. Beside the clothes that they're wearing, beside the makeup that they have, the beautiful smile has a big impact in a person's appearance.
Now, what are the different categories of cosmetic patients, if you had to categorize them, that you see?
Well, there are different patients. One that are, they have really bad smile. They have worn teeth and chip and discoloration. And then there are ones that they have pretty good smile, but they just want to improve it. They want to have that billion-dollar smile.
Okay.
And the third category is the ones that jaw has been shifted and they have grinded their teeth down all the way, and they have so much neck pain and headaches, and they're suffering from TMJ and jaw popping.
And you could take care of that?
Yeah, we can take care of all that with the
But what about somebody tells me,
reconstruction.
Randy, problem with veneers, if you're a teeth grinder, you get veneers, they're just going to chip
They're
off.
just going to chip off, yeah. Because,
so what's the answer then?
Because the position of their bite is not corrected.
So you can fix that?
So we can fix that. That is actually the first thing that we have to consider when we are placing veneers on anybody. So
Okay.
the first thing to consider is if their bite is in the correct position.
We're going to take a quick break, and we're going to look at those photos. I mean, those are good photos. You didn't doctor those up at all? Okay, because they do look good. And, you make a statement that you do more cosmetic dentistry, full mouth reconstruction, in 1 month than most dentists nationwide do in a year.
Well, yeah, I mean, it
Not an exaggeration?
Not an exaggeration. I do more full mouth reconstruction than
most guys?
Most guys,
Is there that much to learn? By the way,
there's
cosmetic dentistry.
There's a lot to learn. I mean, it takes a lot of practice to get to where I am right now, and I've done so many of these cases.
Do you develop a better eye over the years, by the way? I mean, when you do construction, look at a mouth today.
It's definitely I'm much better now than when I was 12 years ago. But I've done so many of these cases.
What should somebody look for in a cosmetic dentist?
One should look in their training, how much training they had, and how many cases they do per month. If they have any implant background, if they are going to be
you think that's important, that they should know about dental implants?
That is extremely important, because you don't want to go ahead and if someone has a bridge, you don't want to go ahead and replace it with another bridge. Or if somebody has a bite issue, you don't want to go ahead and restore them or put veneers on the same position that they are right now, because those veneers are going to fail.
Okay.
So it's not a matter of how good they look, it's just, is it going to be functional throughout the years?
But before and afters, people always ask me, Randy, who should I go to? And I try not to refer any particular doctor. People need to know also, this is a real interview.
You should refer him to me,
Yeah, I mean, this is a real interview. I mean, nobody's scripted here. But my question to you is, isn't it about the photos? I mean, you'll know them by how good their work is. I mean, isn't that important too?
Well, one thing you got to realize, if those photos are their actual patients. Because there's a lot of companies out there that would sell photos that these dentists could use, and before and after.
You didn't bring any of those photos, did you?
No, I didn't.
These are all your patients?
Yeah, these are all my patients.
Good.
All the patients that I have in the advertising, they're all my patients. The ones that are on the walls are all my patients. So
good.
I have all the before and after. Some of them I can, some of them I can't show it on, in your show.
They're very private, very successful people.
Yeah, they're very successful people that patient confidentiality is
okay.
basically.
We're going to take a quick break, come back, and we'll look at those photos.
Right.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are with the dentist in Las Vegas that everybody seems to know and talk about when it comes to getting a billion-dollar smile. We'll be right back.